Hello and welcome. My name is Mary Opar. Today I'm going to talk about overweight and obesity in the USA. My objectives for the presentation today is define obesity, causes, risk factors, trends, and prevalence, define and describe the levels of prevention of obesity, describe interdisciplinary team and their roles in preventing obesity, identify at least two DNP competencies used in developing and implementing plan for obesity, identify data elements used to measure the success in the prevention of obesity. According to the latest research, obesity is a complex chronic disease affected by environmental, genetic, physiologic, metabolic, behavioral, and psychological factors. Approximately more than 67% of adults in the US are overweight, or 34% of them are obese. Obesity and overweight has been associated with an increased risk of early mortality and comorbid conditions such as diabetes and cardiovascular diseases. There is also significant health disparities with African American and Latino populations showing significantly higher rates of overweight and obesity. Because of this high prevalence, obesity has become a significant national health concern due to its contribution to the leading causes of preventable death and its associated health cost. So what is obesity and overweight? Mainly, obesity and overweight is determined by BMI. If your BMI is 25 kilogram and meters squared, you'll be considered as overweight. And if your BMI is 30 kilogram per meter squared, you are obese. We have several risk factors for obesity. Number one, genetic influence, whereby we have when there's a family history of chronic diseases and genetic diseases. The second one is lifestyle. If somebody has limited physical activity, they are not engaged in exercise or working out, poor eating habits, smoking, alcohol, and narcotic use. The third factor for obesity is family environment, whereby people consume regular fast food and they watch TV maybe more than 2 hours per day. Also, maybe if they are leading a sedentary lifestyle. The fourth factor for obesity is community and social influences. For example, if the community does not have access to healthy foods, if they don't have full service grocery stores or farmers markets. Also, if the community has an unsafe neighborhood whereby no sidewalks for safe walking or biking, access to safe parks, and maybe there is increased crime rate. The last one is psychological factor, which could be because of depression and eating disorders such as anorexia and bulimia. We have three classes of obesity. One, BMI between 30 to 35. The second one, second class is BMI of 35 to 40. Class 3 is when BMI is greater than 40 and is considered as extreme obesity. There are health consequences associated with obesity. One of them is heart disease, stroke, mental illness, type 2 diabetes, respiratory problems, sleep apnea, cancer of endometrial, breast, prostate, and colon. According to evidence research done by World Health Organization, US has the greatest incidence of overweight and obesity in the world. In 2015, all the states had an obesity prevalence more than 20%. The prevalence rates has been rising steadily in all age groups. There's also disparities in overweight and obesity, which is in segments based on race, ethnicity, gender, age, and socio-economic status. What's the cost of obesity? According to study of national costs attributed to both overweight and obesity, medical expenses accounted for 9.1% of the total US medical expenditure in 1998. The expenses for overweight and obesity have reached as high as $78.5 billion in 1998. We have levels of prevention of obesity, which is primary, secondary, and tertiary. Primary prevention is to decrease the number of new cases. Secondary is to lower the rate of established cases in the community. Tertiary prevention is to stabilize or reduce the amount of disability associated with the disorder. For the sake of this presentation, I'm going to major on primary prevention. Number one is through dietary therapy. This is when there is sensible eating in combination with realistic physical activity goals, which will play an important part in helping obese patients to achieve a healthy weight. The nurse practitioner should be aware that overly restrictive approaches towards eating or extreme dieting can sometimes be detrimental to a healthy eating plan and may lead patient to weight cycle. Normally, it's recommended that the nurse practitioner will refer the patient to a registered dietitian who will conduct assessment and give recommendation accordingly. The recommended strategies for diet therapy, the nurse could encourage the patient to eat healthy foods, fruits, vegetables, emphasize on the importance of regular meals, discuss portion controls, and encourage eating trigger awareness. The second way of preventing obesity is through weight loss. And as a nurse practitioner, effective management of overweight and obesity can be delivered by a variety of healthcare professionals by also setting goals. The initial weight loss goal of 10% of body weight over a 6-month period is realistic for most patients. There are 3 key weight management stages that should be considered when determining an approach and discussing realistic patient goals. For example, prevention of further weight gain, a reduction in body weight, and maintaining long-term weight loss. The third way of preventing obesity is through physical activity. Physical activity has been shown to prevent weight regain when initiated slowly and increase gradually. Also, the nurse practitioner can identify physical activities that the patient enjoy most. On the visit, the practitioner can assess the patient by asking them to complete a physical activity questionnaire, ask open-end questions during the patient interview or exam. The fourth one of preventing obesity is through behavioral management. Basically, this focuses on approaches to overcoming barriers to compliance necessary for the management of overweight and obesity. Common behavioral therapies include self-monitoring, rewards, and stimulus control. Now, for this prevention of obesity, collaboration of interdisciplinary team is required. The team consists of DNP, nurse practitioner, primary care provider, registered dietitian, nutritionist, exercise physiologist, and psychologist. The role of a DNP prepared nurse is to assess the patient on initial visit by utilizing vital signs, medical history, physical examination, and laboratories to determine whether the patient is overweight or obese and whether there are associated health risks such as type 2 diabetes, hypertension, dyslipidemia, and etc. The role of primary care provider is to provide pharmacological treatment, and we should bear in mind that obesity should be reserved for patients. Pharmacological treatment should be reserved for patients who have failed at least 6 months of dietary and behavioral modification resulting in suboptimal weight loss. Regardless of medication, all pharmacological treatment should be prescribed in combination with dietary and behavioral regimens that sustain weight loss. The role of dietitian is to guide the patient about the recommended foods to eat, discuss behavioral motivations, and promote healthy eating. Also do counseling on behavior and lifestyle changes with the goal of addressing nutrition problems and associated medical conditions and diseases. The role of exercise physiologists is to discuss appropriate physical activities with individual patients, recommend physical activities to match the patient's abilities and health status. The role of psychologists is focuses on approaches to overcoming barriers to compliance necessary for the management of overweight and obesity. We have DNP competencies that will help in the planning and providing intervention to prevention of obesity. Number one is building collaborative relationship. The ability to lead change, whether at the individual, family, or community level, is an important skill of APRN nurses. Collaborative leadership is an approach to leading change that uses a shared leadership model. This model has a set of tools that help a group establish shared leadership, trust, insight into the need for change in the community, and understanding of human behaviors and power, and the capacity to use self-reflection in understanding how one's own behavior impacts others. Another competency is communication. Using patient-centered communication with obesity and others by active listening, empathy, and autonomy support shared decision making. The practitioner should use open discussion about obesity in a neutral manner. The nurse practitioner also should recognize the environmental and cultural context of obesity and incorporate this information in their counseling. They should avoid inappropriate language like people with obesity rather than obese people. How do we measure the success for obesity management? This can be done through clinical performance. In evaluating interventions, prevention efforts need to focus not only on implementation and outcomes, but also on the reach of intervention, the ability to influence large numbers of people to achieve population level benefit. Also, we can measure the success through intermediate outcomes, which include increased physical activity, increased consumption of fruits and vegetables, decreased consumption of sugar, sweetened beverages, reduced consumption of high energy dense foods, decreased television viewing, and the ultimate outcome should be reduced obesity, reduced chronic diseases, decreased mortality rates. In conclusion, obesity has reached an epidemic level in the US. According to the Center for Disease Control 2010 statistics shows no states have obesity prevalence rate less than 20%, and 12 states have obesity rates at 30% or greater. More than 2/3 of adults of Americans are overweight or obese. As you know, obesity is associated with mortality and morbidity, as well as hospital length of stay and overall health cost. Effective management of overweight and obesity can be delivered by a variety of healthcare professionals, including primary care providers, APRN, registered nurses, nutritionists, and physical therapists and psychologists. Our society faces many challenges in adequately responding to the epidemic of obesity. More than ever, nurses must take a leadership role in responding to the epidemic. The obesity challenge does not seem to reflect a complex lack of knowledge on the part of our society, because the problems associated with obesity, particularly in adults, are well documented in scientific literature, popular media, and press. Rather, the challenge relates to our society's ability or inability to act on that knowledge. Thank you.